Warfarin. I'm maybe two to 3 weeks out from being on Warfarin. Straight after the operation, as I mentioned in previous videos, I was on heparin. I was on a heparin drip, and that was to cause the anticoagulation mechanism in the blood. It was slightly different to Warfarin, and that was just to wait until the Warfarin kicked in. So I've been home now 2 weeks. It's 3 weeks since the operation, 2 weeks since discharge. So pretty much been on Warfarin on my own outside of that hospital environment for around 2 weeks. And to be fair, I found it fairly easy to deal with, and appreciate I'm only 2 weeks out. So long road, seeing as I'm going to be on Warfarin for life pretty much. So in the UK, it's fairly standard that you're assigned to a anticoagulation clinic. For me, that's at my local hospital. So it's fairly easy to get to. It's probably a 5-minute drive, if that. And if anything, it's actually closer than my doctor's surgery, which is really good. You get given anticoagulation book, so the yellow book. So when you're in the waiting room waiting for the tests and the anti-COAG clinic, you can spot your fellow Warfarin takers by this. And it's really just a record of your INR levels and what your dosage is. So I came out of hospital on the Tuesday. My first anti-COAG clinic was on the Friday. And just looking at a book, I was 2.2 on my INR. I was 2.0 when I came out of hospital, so it'd gone up slightly, but they weren't sure if I was on the way up or on the way down, or if I was plateauing, because when I was in hospital I was on 10 milligrams, and then when I came out they reduced me down to 7 milligrams, so they weren't too sure. So I went for another checkup on the Monday, so 3 days later, and I was 2.0. So I was in fact on the way down from those 10 milligram dosages, and they felt that maybe 7 milligrams wasn't enough, but they didn't want to bump me up the full whack to maybe 8, 9 or 10. So I was put on 7 to 8 milligram alternating dosages. So on that Monday I took 8 milligrams, Tuesday 7 milligrams, Wednesday 8, so on and so forth. I had a test on that Friday, and that was 2.5, so spot on, right in the middle of the INR range that the surgeon wants me to be on, so between 2 and 3, so absolutely perfect. But again, they wanted another check on the Monday, so a few days afterwards, just to see where my true level was. Am I up? Am I down? Is it plateauing? So I went on Monday, so Monday just gone, the 9th of March, and I was 2.3, so they're really happy with that. You know, I've gone to 2.2 to 2.0 to 2.5 to 2.3, and then they've switched me now to weekly checkup. So I'll go again on Monday. I'm continuing with my 7 to 8 milligram dosages, so alternate days, and hopefully, fingers crossed, on the Monday when I go in, that'll be the furthest or the longest distance, shall I say, between checks. I'm not sure if this is the same for every anti-COAG clinic in the UK, across the world, but it is just a finger prick test, and they actually use the CoaguCheck machines that you can buy, obviously for home testing or whatever. It's really simple, really easy, really quick, painless. You know, I don't suffer from diabetes or anything, so this was my first taste, if you like, of the finger prick with the spring-loaded lance that goes into your finger. Very quick, very painless. Obviously you feel it, but it's more of a niggly sort of pain. They get the blood out and they put it on a strip, which is in a machine, and within seconds you get your INR levels. Then the way it works in my clinic is you go to another waiting room, maybe wait 5 to 10 minutes, and then you get to see the anticoagulation nurse who then either increases your dose, decreases it, and tells you when your next appointment's going to be. The good thing with my INR level, now that they're fairly happy that it's controlled, is that when I go in on Monday, I'll just have the finger prick check. So I have my INR levels taken, and then I get to go. So I don't need to wait around for the nurse or anything like that, which is really good. So hopefully those appointments now will be minutes rather than, you know, half hour to an hour, depending on the clinic and the delay. So really happy with how my INR is going. Appreciate I'm only 2 weeks into this, but so far so good. So side effects from Warfarin so far have been quite minimal. Obviously I'm on my 6-week post-op rest, so I'm not really doing anything too strenuous. The one thing I noticed when I first started taking Warfarin, and it may have been because I was taking it in conjunction with the heparin in hospital, I had really bad sort of bleeding lips, bleeding sort of the inside of the lips. And I only really noticed it when I took a sip of water from a paper cup, pulled a cup away, and there was just blood all the way around it. And then maybe the first couple of times I blew my nose after taking Warfarin, there was a bit of blood in the mucus. But other than that, since, you know, my lips have been fine, blowing my nose, it's kind of back to normal. There's no sort of blood in the mucus. And in general, no real repercussions. I mentioned in a previous video, my last 24 to 36 hours in the hospital was very intense in taking bloods, and you can't really see in the video, so just there. I did have a lot of bruising from that. I've never really bruised from blood tests before, so I'm assuming that is a consequence of the Warfarin. And my dog, well, one of my dogs, she ran headfirst into my shin the other day, and I fully expected a bruise to come up, but touch wood, I've had nothing. But I'm expecting certainly one of the side effects is to be able to bruise a lot more easily. But so far, no real concerns over that, you know, bleeding or anything. Like I say, my INR ideal level is between 2 and 3. Last check was 2.3, so it's pretty much bang on where they want it. So it's not too high. Won't expect any sort of repercussions at the moment from that. You know, when I start getting back fully active, out and about, doing things, then maybe I'll start seeing the side effects of the Warfarin and having a higher INR level than most.